My name's Paul Van Buynder. I'm a professor in public health at Griffith University. I'm one of 5 medical officers employed by Injurynet to manage COVID for a wide variety of companies that are using our services at the moment. I've had 30 years experience in infectious disease and outbreak control, and previously managed the pandemic of H1N1 for the province of New Brunswick in Canada. So Injurynet has enormous expertise across the 5 medical practitioners in assisting companies. This is a full service process ranging from, for a major medical facility or medical organisation, we look after cases of COVID within their group. We look after exposure of COVID for their workers. We look after the implications for isolation, for treatment processes, whether their families may be impacted. So anything to do with exposure of a worker to potentially COVID or actual illness, and when people should be managed in what way, is managed by Injurynet on behalf of that company. Similarly, we've worked with a number of companies to provide advice on whether workplaces are safe to re-establish themselves post-working from home. This includes a variety of activities like assessing the workplace itself, providing advice on social distancing, providing advice on visitors, whether temperature checks are worth doing, whether they should still allow hot desking, whether they should close their staff rooms because of the risk associated with people eating together, and so on. So this provides a strategy for workplaces to reopen after receiving advice from Injurynet. There are often requests to support organisations with regard to high-risk groups. Recently, a major retail chain requested advice on how to manage 70-year-olds returning to the workplace. We know that 70-year-olds have an 8% mortality if they develop COVID-19 disease. And so this was a matter of looking at how we assessed them and how we modified the workplaces to make sure that it was safe for them to return to work without increasing their risk of developing a severe disease. And that can be more general advice. We've provided advice on the issue with pregnant women in workplaces moving forward, and sometimes that revolves advice about individual people and their medication and what's happening, and whether or not a specific person should work from home or is able to go back in to the workplace. This is a full service medical advisory service, and we provide that 24/7 through a range of physicians through the whole gamut of the management of COVID disease. In addition to providing direct advice to the employers about their workplaces, their staff and individual risks, there's also a mechanism for the physicians involved at Injurynet to provide a telehealth service dealing with the individual themselves and also dealing with their treating practitioners to assess in more detail the risks associated with COVID in that person.